name is Valerie Richburg, and I'm currently a dental assistant at Prisma Health on the Richland campus. And I'm a veteran from the United States Navy, the year of 1995-2003. That's 7 years, 9 months, 12 days, 16 and a half hours.
My name is Pam Folger. For Prisma Health, I am a practice operations manager. I was in the United States Navy. I was a hospital corpsman, second class, petty officer, second class, and I served for 5 years.
My name is Seth Quarles. I'm a supervisor of restorative therapy, and I served in the United States Army.
My name is Rick Barnett. I'm the imaging manager at Greenville Outpatient Radiology. I served in the United States Air Force from 1979 to 1983 as a sergeant, in the United States Army from 1983 to 1988 as a staff sergeant, and the South Carolina State Guard from 2011 to 2019 as a Chief Warrant Officer 3.
I'm Amy Benny. I am a nurse manager at Prisma Health Toomey in the family birthplace. I served our country in the United States Army Reserves, Army Nurse Corps.
My name is Cornell Thomas. My role at Prisma, laboratory courier, and I served in the United States Army.
My name is Owen Webb. I work in the Technical Systems Education Department. I'm in the Army National Guard. I'm a first sergeant, and I've been in for 17 years.
My name is Cynthia Winston. I am the Director of Patient Education and Clinical Support, and I served in the Army as well as the Army Reserves.
My name is Kevin McBride. For Prisma Health, I am the Director of our Military and Government Liaison Office. I joined the Marine Corps in 1985. I retired in 2008 as a gunnery sergeant.
My name is Brian Matula. I'm the Security Program Manager, Prisma Health Toomey, United States Navy, Damage Controlman, Petty Officer 3rd Class.
My name is Dr. Brandon Hecht. I am a family physician for Prisma Health. I served in the United States Army. I was the rank of Major, and I served for 8 years.
My name is Teresa Tuther. I work for the Children's Medical Clinics doing project coordination. I served in the United States Army as a staff sergeant for 8 years.
My name is Thomas Funderburk. I'm a transport nurse with the Heart Hospital at Richland, and I've spent 34 years between the U.S. Air Force and the Army National Guard and the Army Reserve.
My name is Robert Carter. I'm a security officer at Prisma Health, and I am currently serving in the United States Marine Corps Reserves, and I've been in for 4.5 years.
My name is Joel Smithwick. I'm a board-certified occupational physician, and I work in occupational health services. I served in the U.S. Navy for 27 years, and I retired as a commander.
My name is Thomas Redman. I serve as a transport volunteer at Toomey Hospital, and served in the United States Air Force, retired in 1993.
Hi, I'm Jackie Cudson. I'm the triage nurse at the Center for Family Medicine in Greer. I was in the U.S. Army in the 80s. I was E4 and served 3 years active, 3 years inactive, and very proud of it.
My name is Caleb Buchanan. I'm the Chief Operating Officer at Prisma Health Richland Hospital, and I was in the United States Air Force.
My name is William Bryant. I'm a practical nurse at Cypress Internal Medicine for Prisma Health. I was in the United States Army. I retired as a Sergeant First Class after 20 years of service.
My name is Benny H. Wood, and I'm a volunteer in radiology here at Toomey. I was in the U.S. Army, and I was a specialist E5. I served 3 years.
My name is Melanie Ballesteros. I am a recovery room nurse at Oconee Memorial. I was a gunnery sergeant in the United States Marine Corps, and I served for 18 years.
My name is Marcelle McBride. I served in the United States Army. I am now an officer for Allied Universal Security.
Hello, my name is Matt Frederick. I'm a radiology supervisor at North Greenville Hospital up in Travelers Rest. I'm in the Army. I'm a sergeant, and I've been serving for 4 years.
My name is Essence Thomas. I am Patient Access Campus Manager at Baptist Campus, U.S. Army.
My name is Ruth Mary Estabrook. I'm the Manager of Patient Placement, the Transfer Center, and I was in the Army and the Air Force.
My name is Jeff Askins. I'm a physical therapist at Prisma Health Toomey, and I served in the United States Army.
My name is Waylon Brown. I'm currently a registered nurse with patient safety and quality. I served in the United States Army for 4 years active duty. I was a sergeant with the 98th Army Band.
My name is Jeremiah Pringle. I'm the Allied Universal Account Manager. I was in the military for 16 years in the United States Army.
Hi, I'm Mike Bundy. I'm the CEO of the Richland Hospital, and I served from 1993 to 2000 on active duty as an airborne infantry officer in the Army.
My name is Elisa Hendricks.
I work at Hillcrest ICU, and I was in the U.S. Navy for 4 years. I was an operations specialist, second class.
My name is R.L. Brown. I'm a hospice chaplain here at Prisma Health, and I served in the United States Marine Corps. Hoorah!
My name is Mark Crabb, and I'm a general and thoracic surgeon at Prisma Health Toomey. I've been here for 30 years. I was in the Air Force for 10 years before I came here.
My name is James Stoppelbean. I work for Ambulance Services in Oconee as an EMT. I served in the United States Army as a specialist for 3 years.
My name is Mark Allen. I'm a PST in behavioral health, and I served in the United States Army. Signal!
My name is Samantha Fisher. I am a registered nurse in the cardiac cath lab at Prisma Health Toomey, and I served in the United States Air Force.
My name is Deshina Sweeney. I'm an operations project analyst in the emergency medicine department up under Dr. Bittner. I was in the United States Navy. I was an E4, and I did it for 5 years.
I am William B.J. Jones, a member of the emergency management team here in the Midlands. I am a retired lieutenant colonel, United States Army.
I'm Mary Fields. I'm a security manager, and I manage the security at Baptist Easley Hospital, Oconee Hospital, and North Graymill Hospital. I served in the United States Air Force. I was a sergeant, and I served for 4 years and 8 months.
I'm Dr. Codio. Currently, I'm a family medicine physician working at the Prisma Health Medical Center of Boiling Spring. I serve in the United States Navy as a naval dental officer. I was a lieutenant in the Navy for 4 years.
People go in for a variety of reasons. A lot of people go in out of sense of duty. Some people go in to learn a trade or a vocation. Some people go in to get away from something even. But the fact of the matter is once you're in, you belong part of the greater good, so to speak. It's bigger than yourself. You literally do sign that blank check saying you're willing to lay down your life if needed to protect this country.
I chose to serve our country because I wanted to follow in my father's footsteps. Although he was a helicopter pilot in Vietnam, serving with what is now 160th SOAR, Special Forces Aviation, I chose to answer the calling by serving in the Army Nurse Corps.
I grew up in a generation where it was not what your country could do for you, it was what you could do for your country, and I wanted to serve my country. So I picked the United States Marine Corps and thought that it was the hardest service to be in. I watched too many Rambo movies, so joined the Marine Corps.
When I decided to go in the military, really I was an 18-year-old kid who I didn't really have any plans in life, but I knew I wanted to do something important in my life.
I felt a call to serve our country because I was in high school at 9/11 and decided to answer the call to serve and particularly to support the fighting troops as a doctor.
In terms of the meaning of Veterans Day, I always reflect that it's the anniversary of the end of the First World War. It's been 104 years ago now, and in that war, about 100,000 active duty members died. Another 3 times that number were wounded and sick. And one of those folks was my grandfather. So that sort of brings that home and makes me remember the sacrifices that all those people made for us.
I decided to serve my country because I really want to follow in the footsteps of my true hero, which was my older brother.
I chose to serve our country because my brother, Sergeant First Class Michael Pedersen, died in Afghanistan in 2001 when the war first started. So I needed to understand the purpose behind why he served.
So I think it's important for people to honor Veterans Day and remember Veterans Day because, like myself, there are thousands of us that came home without any disability, but there's also many more people that either came home with a disability or weren't able to come home at all. And it shows respect for their ultimate sacrifice to their country.
Well, I think that serving is one of the greatest experiences, as an American.
Both my grandfathers served in World War II on active duty. My dad and stepdad were both Marines, and my brother's also an Army officer.
I decided to join the Navy to give back to this country. I was not born in the United States, but I always felt welcome I received a lot of opportunities, and I really wanted to give back, and it was a great experience.
There's nothing more rewarding for me as a physician to see a veteran in the office wearing a hat than to stop our office visit and talk about that veteran's experience. And I think that's one of the main reasons why I came to Sumter, was to be involved with veterans in this community, both the 3rd Army as well as 9th Air Force, as well as Navy and Marine veterans that live and retired here as well.
I joined the Army way back when I was 19 years old because I wanted to serve my country. I learned about discipline, sacrifice, leadership, and brotherhood. And I experienced all of those things at Prisma. And I think it's great that we're honoring our veterans who put a lot on the line for us every day.